Let's break down the OET speaking test format.
Okay, first things first, there's one thing you absolutely have to get your head around. The OET speaking test, it isn't just a language test. It's really a communications test. And that single idea, that shift in thinking, it changes everything about how you should prep for this exam.
So what does that actually mean, being a communication test? Well, in practice, it means the whole thing is built around interaction. We're talking about simulating scenarios you'd actually face in a clinical setting. And here's what's so different about it. This is not your typical exam interview, where an examiner just grills you with questions. Nope. Instead, you're jumping into a role play. The person you're talking to, they're not an examiner in that moment, they're your patient, or maybe a concerned family member. Your entire job is to be the healthcare professional in that room. All right, to really see how this simulation plays out, we've got to look at the test structure. It's actually broken down into 3 really clear stages. So the whole thing takes about 20 minutes from start to finish. And as you can see, it follows a really clear process. You've got your introduction, then some prep time, and then you dive into 2 different role plays. So let's just break that down a bit more clearly. First up, you have the introduction, just a bit of small talk. Then, and this is key, you get 3 minutes of prep time for each role play. And finally, you actually do the role play, which lasts for about 5 minutes. Now, this is super important to remember. That introduction part, it's just a warm-up. It's not assessed at all. It's literally just there to help you relax. The real deal, where you're actually being evaluated, is the role play. That's your time to shine and show what you can do. Okay, so you might be thinking, how on earth do I know what to do in the role play? Well, that's where this next thing comes in. It's probably the most important tool you'll have on test day, the role play card. So what is a role play card exactly? This right here is an example of a role play card. You're going to get one of these before each of your role plays. And remember that 3-minute prep time we talked about? That's your chance to read this card, really understand the situation, and think about how you're going to handle it. Let's take a closer look at how these cards are laid out. They always start by giving you context. First, you've got the setting, which tells you where you are, a suburban clinic, a hospital ward, whatever it might be. Then it outlines your role, in this case, doctor, and gives you some background on the patient and the situation you're about to walk into. And that brings us to the real meat of the card, the task section. Now listen, this is so important. This is not a script you have to follow word for word. Think of it more as a roadmap for your conversation. It gives you key points to hit, like explaining the causes of asthma, talking about treatment, and, crucially, dealing with how the patient is feeling, like their anxiety. And that leads us to a really, really common mistake people make. There's a huge difference between just completing the tasks on the card and actually meeting the test's scoring criteria. Let me be crystal clear about this because it's a direct quote from the official materials. Your score is not based on how many tasks you manage to check off. It's based on your language ability and your clinical communication skills during the conversation. This little table here really spells it out. The tasks on the card, they're your guide. They're there to give the role play some structure and direction. But the scoring criteria, that's what the assessor is actually using to grade you. The tasks just give you the opportunity to show the skills that are being scored. So what are they actually looking for? Well, the criteria fall into 2 big buckets. You've got linguistic criteria, that's your grammar, fluency, pronunciation, that kind of thing. And then you have clinical communication criteria, which is all about your professional skills, like showing empathy, building a relationship, and explaining things in a way the patient can understand. So I want to leave you with a final question that should really frame your entire preparation strategy. Are you practicing to just tick off a checklist, or are you practicing how to build a real clinical relationship with a patient? Because understanding that difference, that's the real key to acing the OET speaking test.